Welcome to Efficient Abstracting, presented by Registry Partners. The objectives of this are to help you abstract as efficiently as possible using your desk setup and office space, developing a plan for organization of the abstracts, tips for utilizing the electronic medical records and registry systems efficiently, and the importance of text and when to complete it. Desk setup. Are the paper manuals within easy reach? You can also use electronic manuals when possible, for example, the CS, the Fords, and the multiple primary and histology rules. Are these manuals marked for ease of finding the correct manual and the correct site within the manual? For example, you can highlight the AJCC manual with the common sites. For example, breast, prostate, colon, and lung are good sites to mark for ease of finding. You can also utilize electronic post-its and highlighting in the PDF versions of Fords and the multiple primary and histology rules. Are your quick reference guides with an easy line of sight? Some of the things that you use often, maybe, are the chemotherapy drugs that changed to immunotherapy in 2013, your class of case definitions from Fords, and your ambiguous terms from Fords and CS. Do you have dual monitors? We highly recommend dual monitors because you can have the electronic medical record system on one and the registry system on the other, and thereby reduce toggling from one system to the next. If you need a printer, is it ready to use? Are the ink and paper filled? And is it connected to your PC? Is it possible to use more than one computer if perhaps when you log into the electronic medical record system, it blocks your internet access, which also blocks your access to sites such as the SeerRx, the Forum, and Sync. This is an example of when another computer would be an excellent idea if that is available. Also, sometimes you're unable to bring up the registry software and the EMR at the same time. If this happens, another computer will allow you to have them both up at the same time. Next, your office space. Is it quiet? Are there going to be multiple interruptions? Try to work at the same time every day. Set aside a time that is usually quiet or when minimal eruptions will occur, maybe after dinner or early in the morning. Set aside a dedicated office space. This gets you into the thought that it is time to work and it gets you in that work mode. Ask family and friends not to disturb you during the scheduled work hours or to make those interruptions minimal. Are there other distractions that could be minimized? Can another family member care for younger children or maybe plan daycare? Ensuring a quiet office space and a time that is dedicated to work will also ensure efficient abstracting. Next, we'll talk about your case organization. So you have your case list for abstraction. Now what? Unless instructed by a manager to complete certain cases first, you can complete cases of the same site first. This allows you to pull up your manuals on that site without having to switch between sites. For example, if all July 2014 cases are assigned to you, you can group them by site and abstract one site at a time. This allows you to get familiar with that primary site. What are the common symptoms of this, the workup, and the treatment? What are the common areas for the primary tumor spread? What are the regional lymph nodes for this site? And what are the most common metastatic sites? This allows you to get familiar with this one site and also prevents you from moving from manual to manual and trying to find these sites. This also allows you to get familiar with the treating physicians. They're likely to be the same or a smaller group of physicians, thereby allowing familiarity with the notes and the physicians' names that need to be placed in the abstract. You can open your AJCC, the CS, the multiple primary manual, and the NCCN guidelines to the site being abstracted, saving time flipping back and forth. Bring up any other helpful resources or websites. For example, the Forum, the Sync, the SeerRx, and NACER-approved abbreviations. Think about what is needed to complete the case. Is this a non-analytic case that can be completed without requests for information? Complete the most difficult cases during the times of greatest mental acuity. For example, during the morning, are you a morning person or are you a night owl? Maybe completing that head and neck case at 9 p.m. if you're a morning person is not the best idea. Finally, we're ready to begin abstracting. Access your suspense case or listing for abstraction, and then log into all your electronic medical record systems and registry software. Check the registry database first for the case to ensure it has not already been abstracted. This may happen especially if the patient has more than one primary or if other staff members are also abstracting. This will save you time reviewing the electronic medical record if the case is already completed. Should you open one system first? Does it take longer to open a system than another? Maybe you could start in the quicker system reviewing records. If you start a case and don't finish it, mark the suspense list as such and complete it during the next workday. This ensures that cases do not slip through the cracks or end up as incomplete. Abstract directly into the registry software if possible. Avoid paper abstraction when at all possible, as this does slow down abstracting efficiently. Complete your text first and then move to coding. This allows you time to review all the notes in the EMR and make corrections to the text and decreases the need to correct coding fields as new information is read. If the registry system cannot be accessed at the same time, open a Word document and type the text or copy and paste from the EMR, if possible, into the Word document. You can then copy and paste into the registry system later. Ensure that this is cleaned up before transferring into the registry system. For example, remove the unnecessary spaces or punctuation. Follow the instructions for each field. Have your manual open so that you can access easily the instructions for a field if it's not clear to you. If you're unfamiliar with which fields to complete in the abstract, you can ask your manager or another coworker for an example case to follow. The EMR system. Do you have more than one? If so, which one is the most important to review first? What is housed in each system? Knowing which system has which information can help you abstract more efficiently by reviewing that system first. Is there overlap of information between these systems that can be skipped in the second system if the first system has already been reviewed? If so, is there a priority for using these systems? For example, you may want to use the hospital's electronic records first and then open the radiation oncology records to see if there's any new or different information in that record. Determine if the EMR is set up by visit or service type. If this is by visit, begin reviewing the first visit around the time of diagnosis. You can check for physician notes, pathology, and/or radiology first. If an older visit would contain the first workup, move to that visit and work your way to the next visit to minimize skipping around. If the EMR system is arranged by service type, review the pathology first and text any pertinent pathology while making notes regarding tumor extension, lymph nodes, and metastatic disease. Secondly, review radiology and again complete the text with pertinent findings. Move to the operative reports, text for type of operation, findings during the procedure, and any scopes that may have been performed. Then move into the medical and radiation oncology notes. These notes usually contain the best information pertinent to the cancer without involving a lot of information regarding the patient's other comorbidities. Finally, review any H&Ps or discharge summary for further information. For example, the H&P may have some social history or family history that might need to be collected. The last thing to look at is your lab findings for tumor markers and other lab work that might be pertinent to the cancer. For example, if you have LDH for melanomas. Now for the physician notes. How are they organized? The first part of the physician note usually gives presentation of the patient, the age, and some social information. If this is the first consult, review the physical exam for pertinent physical exam findings. And remember, only pertinent information needs to be documented: the primary site area, lymph nodes, and any metastatic nodules or areas. For example, for a prostate case, documentation of the DRE and findings from that DRE would be in this location. The last part of the note usually contains the staging and impression as well as treatment plan information. Many follow-up notes are cut and pasted with only small details added. So the best thing to do is check the first part of the note for any new symptoms or complaints in that follow-up. Then move to the end of the note to see if the impression or treatment plan has changed from the first consult. There's no need to reread the entire note if most of the information was contained in that first consultation. Now moving into the text. How much is too little or too much? Basically, ask yourself, could someone re-abstract my case from my text? If the answer is yes, then you have enough text. Record findings pertinent to the cancer only. The fact that there are degenerative changes in the spine is probably not pertinent to a colon cancer case. And every negative finding does not have to be documented. For example, if a chest CT states no evidence of adenopathy or metastatic disease in the chest, we do not need to list all of the sites the CT mentions, such as hilar nodes, mediastinal nodes, negative, supraclavicular nodes, negative. We can just simply state there's no adenopathy. Utilize the NACER abbreviations and memorize the most common ones. This will help when texting, as you do not have to type out as much. And if you memorize the common ones, it'll almost become second nature to use those. Think while reading and texting. Think about the patient's story while you're reading the EMR. How did the patient present? What was the workup that was performed? What were the treatments? How were they diagnosed? You can take mental or physical notes about the presentation, the tumor extension, treatment plan, and stage that will help you later in the abstract. This way you don't have to go back and find that note where you read that information. Think about how the CS and the AJCC will be coded while texting. The pathology information will affect the CS and the stage. So think about how that will affect that while you're texting the pathology. How will the treatment be coded? For example, the patient has had surgery. Well, what type? Is it open, endoscopic, laparoscopic, robotic? Were lymph nodes removed? Were other sites biopsied? This will help you later when you need to code the surgery that was performed. Lastly, think about your questions. If you have questions that you can't find the answer to, you need to be specific in what you need your manager or a coworker to review. Avoid general requests such as, please review abstract number for me. The reasoning is that the person reviewing the abstract may skip over or may not even think about the information that you really need them to look at. Provide detail on which abstract, what, need help on CS extension, where, see the April 2014 encounter and review the 401-2000 path and the 320 PET scan. This allows them to see exactly what you're questioning and where to locate those documents. Edits. If you cannot clear the edits, please notify the manager or registry software for help. This sometimes avoids you having to look through each and every piece of the abstract to try to determine why the edit was there. Someone else may have already encountered this edit and can show you exactly why you're getting an edit. And when you do ask questions, ensure that you use secure methods of communication. For example, if using email, remember the accession number and medical record number are considered identifiable PHI. So this needs to be placed in a secure email. In conclusion, we hope we have helped you become more efficient in your abstracting and given you some tips for this. Remember to organize your desk and office space so that it's easy to reach your manuals and see your quick reference guides. Complete the same site at the same time if possible to minimize flipping through the manuals. Log into all your systems if possible and know which system to review first. Use your text first and think about the case while texting into the registry system so that the coding will be faster. And lastly, be specific in your questions if you do have questions. This allows not only you to be more efficient, but the person reviewing your abstract. We hope that you have found this presentation helpful and you'll have some new tips and information that will help you abstract more efficiently. Thank you and have a wonderful day.